Hello and welcome to another Political Futures event. This year has undoubtedly been one of the most difficult years in modern history. This is something that is said very often. I'm sure some of you may have heard this today. Indeed, there has been much coverage of the coronavirus pandemic in terms of the number of cases and the deaths that have resulted from these cases. However, there has been comparatively little talk of the perceptions of COVID-19 and the behavioral impacts it has on individuals. With us today to talk about just this is the economist from the Rand Corporation, Katherine Carman. Katherine was a Robert Wood Johnson Scholar in Health Policy Research at Harvard University. She is currently the director of Rand's Center for Financial and Economic Decision Making and is a professor at the Pardee Rand Graduate School. Her research focuses on behavioral economics, health economics, and public economics. Katherine has a specific interest in how individuals' beliefs, perceptions, and decision-making processes affect their choices. She is at present studying the broad impacts of COVID, including the impacts on behaviors, beliefs, financial well-being, emotional well-being, and social values. Katherine, thank you for joining us here today. Over to you.
All right, great. Thank you so much for having me. I'm very pleased to be here to talk to you all today. Understanding how people prepare for and respond to large-scale disasters is actually one of the things that is really my main research interests. For the last 3 years, even before any of this started, before we were talking about COVID, my close collaborators and I have been working on planning for how to do research when disasters occur, so that when bad things happen, we're prepared to start thinking about them. We know bad things are going to come. We don't know what they will be, but we know they're coming. We know that there could be hurricanes, floods, earthquakes, terrorist attacks, nuclear disasters, all sorts of things. These things are going to happen, and societies and individuals are planning for them and preparing for them in some way over time. And so these are things that we have been thinking about for the last several years. And while I never dreamed we'd be dealing with a pandemic of this scope, I've been worried about how we will study these issues for a long time. And in particular, I'm interested in how people's knowledge and information and beliefs affect their behavior. So I'm going to share my screen. And let's see, I need to change this so that it's full screen over here. Just give me 1 second. Where is my mouse? Apologies, technical difficulties.
No worries, no worries.
These
are unprecedented times.
I've completely lost, there it is. Completely lost my mouse. But you don't all need to see my email in the background. All right, there is my screen. There we go. So that's what I'm going to talk about today. And we're going to start with one more technical difficulty. There we go.
Oh, no worries.
There we go. Oh, that should not have gone to the very last slide. From the beginning to the end, in the very beginning, that would be not so interesting. Start all the way at the top. We'll try the slideshow again. All right. So I want you to think back to January. Where were you in January and what were you thinking about? Maybe you had heard something about...
This is just building suspense, I'm telling you.
Maybe you had heard something about this weird disease that was sweeping Wuhan. I can tell you where I was. I was sitting at my kitchen table playing Pandemic, literally playing Pandemic, with my best friend who is from England and who was here in California visiting me. And we were talking about what we had heard about this disease, but we really didn't think that anything of it. We didn't think that it was coming. I remember saying, it's a bit strange that it seems like this could spread across asymptomatic people, and that's a bit scary. But it doesn't seem like it's something we really need to worry about. That was January. By February, our impressions had shifted. By February, I was really starting to get worried and wondering what I should do. And I started asking everyone I could find for money. I started asking for money because to study how people think about these kinds of diseases, we need money to start talking to people. And so in February, I remember very clearly talking to everyone who would listen to me. This is going to be something we need to be worried about, and we need to be worried about it now. We need to be thinking about it. We don't know what it is. We don't know if it's the flu or if it's more, but we need to be thinking about this today. March 11th. What was March 11th? It was my last day in my office. March 11th was also the day that the WHO declared that COVID-19 was a pandemic. This was really a day, I think, when for many of us, our perceptions of what was going on really shifted. We had already begun collecting data about what was happening. We got our first survey about COVID-19 in the field on March 3rd, only 8 days before this WHO announcement. But it was well after people started talking about and forming perceptions of the novel coronavirus as we were thinking of it in early February. But we should have been better prepared. We knew these bad things. As I said to you at the beginning, this is something I've been thinking about for several years. We know these things are coming. And ideally, we'd be collecting data before events even occur. I know that that sounds like a strange idea, that we would start preparing for disasters before they even occur. But we need to be prepared for disasters before they occur. We need to be thinking about how do we make sure that the houses that we live in are in places that are safe from floods, or safe from hurricanes, or safe from wildfires, or that we are taking precautions that will help keep us safe if there's a new infectious disease. So together with my co-authors from RAND, Andy Parker, Alicia Edelman, and Melissa Finucane, we were writing even last year, although it didn't get published until June of this year, about the need for collecting information about how people think about disasters and how they prepare for disasters before these things happen. We can ask you, what are you doing? What would you do if there was some new disease? So that when things happen, we can see how people are responding. And this is something that, as I said, I've been thinking about for a long time. So when COVID happened, as it started to enroll, we started to see a lot of impacts in many different ways. First of all, of course, illness, loss of life, unprecedented loss of life. Quite shocking to me how many people are dying in the United States today. Yesterday, record number of people died in the United States from COVID-19. And this has also led to extreme changes in our behavior. We weren't wearing masks 18 months ago. We weren't wearing masks 9 months ago. We weren't thinking about whether or not we should go to the grocery store. All of these things have really changed our behavior. But also we've had changes in our perceptions of the disease. Remember, we could have thought about this. Was this the flu? Was this something else? At different points in time, the way we think about COVID-19 has changed. And across people, the way we think about it is different. There's also been significant economic impacts. I think this is really different in the US context than in European contexts. One thing, before I came to RAND, and after I was at Harvard, I actually was a professor at Tilburg University in the Netherlands. And so I've spent a lot of time thinking about how US and European countries, including Great Britain, and the United Kingdom, think about taking care of people in times of trouble. And in the US, we are really not good at that. And the economic impacts here have been tremendous. But maybe this is also a time for us to think about changes in our values and our beliefs about society. And these are all impacts that I have been interested in and trying to study over the last years and 9 months in particular. So thanks to my begging in February and March and April and May, and as long as I could, relatively quick funding, we've been able to start actually 4 separate projects related to COVID-19. And I'm going to talk about one piece of one project today, but I actually am able to talk about more if people are interested in them and later on. So I have got some funding right away from the RAND Corporation, from internal funding at our organization, to study a wide variety of topics, just to lay the land and set the stage for future work. We have a grant from the National Science Foundation in the United States to study how perceptions of disease form, and that's what I'm going to focus my discussion on today. We also have a grant to study the implications of changes in employment on financial well-being and how the way that you work can protect your financial well-being and your emotional well-being. We have funding from the Robert Wood Johnson Foundation in the United States to study how these changes in our society and the experiences that we're having affect our views and values and beliefs among the U.S. population. So now I'll switch to this paper that I'll talk about for the bulk of the time today, about the relationship between perceived analogies of COVID-19 and protective behaviors. And this is evidence from a national survey co-authored with my friend Wendy Brown de Brown, who's at the University of Southern California, although as recently as December last year, was at Leeds, and my colleague at RAND, Andy Parker. And this work was funded by a wide variety of sources: the Bill and Melinda Gates Foundation, the National Institute on Aging, the National Science Foundation, the University of Southern California's Schaefer Center, the Swedish Riksbankens. I can't even pronounce the things that Wendy has for all of her funding. We have a lot of funding that helped us to bring this work together. So what we're going to think about is analogies. So as we were talking earlier, back in March, February, January, COVID-19 was a novel threat. We did not know what we were dealing with. We didn't know where we were. We didn't know what it was. And we use analogies to understand how new information, information. So we think about things that we know, and we use that to help us understand this new threat or new information that's coming at us. So people have associated smallpox with chickenpox to help them understand smallpox. But this can actually be, can backfire, because smallpox is a disease that largely affects adults, while chickenpox is largely something that affects children. And if you prepare for a disease that affects children when you're worrying about a disease that actually affects adults, you won't be creating the right strategies in your mind to help you prepare for this. Similarly, we have done some work during the Zika, the spread of Zika, and we found that people, of course, did not know what that was when that first started. I remember reading those first articles about Zika, and what did we know? We knew that babies were being born with strange deformities, but we didn't know what it was. And people were thinking about how they could protect themselves. Some people realized that quickly that this was mosquito-borne, and they were taking actions to protect themselves that were relevant for mosquito-borne illnesses. But other people were drawing analogies to diseases like influenza. Well, if you wash your hands, doesn't matter how many times you wash your hands, that's not going to protect you from Zika. And if you're drawing an analogy in your mind between a disease that is similar to the disease you're facing, you might take appropriate protective behaviors. But if you're drawing an analogy in your mind to a disease that is not at all like the disease you're facing, then perhaps you won't take appropriate protective behaviors. So in this case, those who thought of Zika as being something like influenza, they weren't doing the right things at all to protect themselves. So back in March, people were talking about COVID-19. Was it the same as influenza, the seasonal flu? And we wanted to look at whether or not this actually influenced how people behaved. So we asked people in March which analogies they used to think about COVID-19. And then we looked to see how those analogies were related to their reported protective behaviors. We used a survey that's being conducted every 2 weeks since March, asking people about protective behaviors and risk perceptions. And in March, we added questions about analogies. This is a US-based survey, and it's a nationally representative sample of about 6,000 Americans. So our survey was conducted between March 10th and March 31st, right in this particular survey, right in that sweet spot of when we were starting to call COVID-19 a pandemic. We have over 6,000 respondents, and they're roughly representative of the US population in terms of their age and gender and race. So we asked people this question. It was an open-ended question. When you think about coronavirus, COVID-19, what other diseases come to mind? And people could fill in the 3 boxes with whatever they thought of. We didn't prompt them in any way. We just said, what do you think it is? We also asked them about their self-reported protective behaviors. Did they wash their hands? Did they avoid public spaces? Did they avoid contact with people who could be high risk? At this time, particularly in the United States, there was a lot of fear and racism around avoiding Asians in particular. And so we asked about avoiding people who could be high risk for giving you the disease. Did you cancel or postpone air travel? And we also asked people about their perceptions of risk. What, on a scale from 0 to 100%, what is the chance that you will get coronavirus in the next 3 months? And if you get it, what's the chance that you'll die from it? This is a question that my co-authors and I have been asking about influenza and other diseases for many years. And while people's answers to these questions are not spot on, they don't get the numbers right, they are informative. People generally know when they're at greater risk and when they're at less risk. And this also gives you a sense of how afraid they are. Are they really, really worried about this, or do they think it's not such a big concern? So first we'll look at whether or not what analogies people were using for COVID-19. There were two main categories that people wrote in. Remember, we didn't tell them what to write. They could write anything they wanted. We had everyone write this in, and then we had 2 ways of coding it. The first was that we had a graduate student go through all 6,000 of these and code them by hand as either just coding up what they were. Seasonal influenza, that could be influenza, the flu, written something like that. Common cold, pneumonia. Those were common infectious diseases that we have lots of experience with. We also saw people writing things about emergent infectious diseases, things that we don't have so much experience with. So that might be something like pandemic influenza. Here you should think of the influenza pandemic of 1918. People wrote in H1N1, swine flu, all sorts of things that are the flu, but they have names associated with them. It's not just the normal, every winter we worry about getting the flu. Some people wrote SARS or MERS. They wrote Ebola. There are things that are new and we don't really know what they are, and they're a little scary. So we had this graduate student code everything. We also used a machine learning algorithm and had the computer code things. And there was actually extremely high intercoder agreement across these 2 methods. The computer and the graduate student got largely the same answers in terms of how they coded these different write-in responses. So now we'll look at how those analogies are associated with their self-reported protective behaviors. So for this, we asked people what they were doing. 90% of people said they washed their hands. This is what we were all hearing at this time. Wash your hands, wash your hands, wash your hands. A smaller percentage of people were avoiding public spaces and crowds. A smaller percentage of people, a similar percentage, were avoiding high-risk individuals. Some reported that they were canceling or postponing travel. That's a smaller group for 2 reasons. One, because you can only cancel or postpone travel if you have something scheduled. And at that time, I canceled a trip. I canceled a trip on March 10th that was scheduled to take place on March 18th. But it took another 2 weeks for me to cancel my trip that was scheduled for April 1st. And it took much longer for me to postpone travel for the summer. And if I hadn't had all those trips, I would have answered that question differently. So that lower percentage there is different. We also asked about a bunch of other interesting protective behaviors. a number of people, in fact, one of the most common things that people reported that they were doing to protect themselves was praying. We asked about things like eating carefully, exercising, all sorts of things. But these were the ones that were really the most relevant and where we saw the most consistent kind of behavior. So when we look at this, what we see is that mentioning these common as opposed to emergent infectious diseases was associated in engaging in less protective behaviors. So if you think that this is just a simple flu, you don't take as much precaution. If you think that this is SARS or MERS or Ebola or the 1918 flu pandemic, then you realize, then you're taking much more taking on much more protective behaviors. The exception is pneumonia, and that could be because pneumonia is seen as a more severe disease than certainly the common cold or even influenza. Influenza is serious and does kill people every year, but the risk of death from influenza is far, far, far below the risk of death from these other diseases. And it turns out, as we know now, far below the risk of death from COVID-19. We also looked at this in the context of regression analysis. And in these regressions, we controlled for other things, including those risk perceptions that I talked about, and for individuals' demographic characteristics. And here we see, as before, that we don't see much impact for the common diseases. We see a strong relationship for pneumonia and a strong relationship in particular for SARS and MERS and Ebola. So what can we do with this information? I talk far too fast, and I've gone through my slides far faster than I expected to. I'm used to economic seminars where people interrupt me all the time and ask 500 questions. But early on in the pandemic, people associated COVID-19 with common and emergent infectious diseases. And thinking of COVID-19 as seasonal flu tended to be associated with engaging in less protective behaviors. Thinking of COVID-19 as pneumonia or Ebola tended to be associated with engaging in more protective behaviors. And I think that these findings still hold even when you start to account for risk perceptions and demographics. So even after you account for the fact that people have different levels of risk, even after you account for the fact that they're different ages, we still find that there are these relationships in their behavior. And I think that as we think about the results, what does this mean and what should we do with it? I think when we're doing this kind of research, one of the reasons why I think it's so important, it's not just to understand how perceptions are formed, which as a scientist is infinitely interesting to me, but it's also because these are really truly matters of life and death. When we think about disasters in terms of COVID or any of those other disasters I mentioned at the beginning, how people think about those risks and how people prepare for those risks is really crucial to how safe they are and how protected they are from those risks. And so we need to think about how we can communicate with people in a way that will resonate with them, in a way that will promote protective behaviors. And I think that the early response, where we talked about COVID-19 as being like influenza, really, really was an ineffective analogy. It really hurt our health communications with regards to how people responded. Influenza doesn't scare people. Influenza doesn't scare you. I mean, we are all young. We don't have a great risk of dying from influenza. We're not particularly worried that we're going to get someone else sick with influenza. It just doesn't lead us to change our behavior in a way that is going to help protect ourselves and protect others. And so when we're thinking about how to communicate with people, we really should have been using something different. Now, of course, at that time, we didn't know how bad things were going to be. But as we think about things over time, We need to have communication strategies that resonate with people, but also are going to promote protective behavior. I should say that there is a limitation of our work. This is just correlational in nature. We have not actually gone in and tested this. We've not given people different messages to see how they respond. That's something that's very difficult to do in the context of a developing pandemic or other disaster. And that's because no matter what message we give you, you're getting messages all around you. You're getting messages from the internet, you're getting messages from the news, you're getting messages from your friends, from your parents, you're getting messages all around you. And any intervention we could try to do would be very difficult because there's so much noise out there. We have been thinking about ways to do interventions to test this in the case of hypothetical diseases. And when I talk, especially to students, I like to talk about how the research is done, not just the conclusions of our research, to help to give you some insight into the kinds of work that we do so that you will understand how the sausage is made. And so one of the things we've been talking about is, can we come up with hypothetical stories that we share with people about different kinds of diseases and ask them how they would respond to them, and test how different messages about those hypothetical situations would affect their choices. And if we do that, we start to learn something about how people respond. And then when we step back and think about it, we have a knowledge base that can help us when the real situations arise. When the real disease comes barreling in and we can't figure out, and we've just started to get some information about it, and we need to figure out how to help the general public understand, we have some better strategies for how to communicate with people to help them understand what's at risk and what they're doing. So I think that the best thing at this point, let me tell you two things. I can take some questions on this work, but then I also have some slides here about two other things that we can talk about. And I'm happy to talk about both or just one or whatever sounds the most interesting. But why don't we do some questions about this? And then if we have time, I can talk about one of these other two pieces of work. Does that sound like a good plan?
Of course. Yeah, I mean, just with regards to perceptions of the pandemic, one of the questions that we had was on the grounds of inequities in society, and regarding the perceptions that people have of certain groups and categories of people, and how they understand certain social actors in relation to their perception of the pandemic. And we sort of I've seen through the coronavirus the category emerging of the essential worker, and how these individuals have been understood by people who are in society, sort of legitimate. There have been worries about, due to the effect of coronavirus and the seriousness of it, that by categorizing people as heroes or essential workers, that was effectively legitimizing the very serious economic and indeed health consequences that they were facing in their line of work. How do you think this perception would correspond to the idea of analogies in relation to different diseases that you discussed in the work above?
Yeah, I think that the issue of who is an essential worker and who should we think of as an essential worker and how people perceive that is really important. It's important because there are so many people out there who are doing essential work, and how we think about who we should protect is really important. And recognizing the contributions of essential workers and the perceptions that we create around those essential workers really does make a difference for them in terms of their ability to do these jobs. We can't always pay those people more for taking on greater risk. Some people have gotten hazard pay for taking on greater risk, but we need some way of trying to support those people. It's interesting. We've got some new results that will be coming out soon that looked at people's perceptions of who should get access to vaccines first. And there was broad agreement about healthcare workers. We can all agree on that the healthcare workers are essential workers, but after that, it starts to become tricky. Who's an essential worker? We support essential workers, but who is an essential worker? And the perception of that is something that isn't clearly defined.
Thank you very much. I mean, with regards to inequity, though, so if I may, we have actually prepared some questions for you.
Okay, yes, of course, please.
In general, what kinds of inequity can be seen in health outcomes with regards to the coronavirus and in financial outcomes? And are there any other vectors of inequity which the pandemic has revealed throughout this time?
So I think that there are a number of inequities that we have seen that have been revealed here, and they come across in different ways. One is racial inequities, and one is economic inequities. People who work in jobs that are low paid have less access to protections. They have less job security, and their jobs typically put them at more risk. The person who is making your coffee, they're not very well protected. They don't have a lot of job security in the sense that, that's a job that could go away. That's a kind of business that could easily go away. And so that's one form of inequity that we've seen. Another form of inequity comes from structural racism, which I think exists in all countries. In my experience, in the United States and living abroad, we see forms of us versus them playing out in all sorts of places. And I say that speaking as a very privileged, white person growing up in America. The lower income racial minorities generally have lower access to healthcare. They have less comfort in the healthcare system. Immigrants in particular, and that makes it harder for them to get access to the care that they need, even when the access to the care that they need is paid for. If you are immigrant in the Netherlands from Turkey, even if you have your health insurance cover and you go to the doctor, you don't have the same rapport with your doctor. You don't have the same connection. And that makes it that much harder to get access to the care that you need. And that kind of problem exists, I think, everywhere. And that's one of the problems we've seen with COVID-19 everywhere. And we've been looking at how people's views of equity have shifted or not shifted over time. And I have some results about that I can show you if you want to see them.
Of course.
And let me say, there's one other thing that I think is really important, which is that people who are poor and people who have come from different cultural backgrounds have different expectations about their living environments, and those living environments can help to promote the spread of COVID-19. I live in a house with my husband and my daughter, and that's it. And we have plenty of space. And if any of us were to get sick, we could even isolate within our house. But if you live in a 2-bedroom apartment with 6 people and someone gets sick, there's no protecting anybody else in that house from getting sick. And that has really helped to fuel the spread of COVID-19 among more vulnerable populations.
Sure. I mean, do you think that, or just touching on that, do you think that the living conditions would be of prime importance for determining whether or not someone would follow government policies on how to prevent, say, like wearing the mask, for example, how to prevent the spread of COVID-19, and that they think, oh, there's no point because I can't really do anything in my own living conditions? Or do you think that economic inequities that people just face in society in general might sort of make them feel that the government isn't looking out for me anyway, so I just won't sort of follow such policies?
We haven't seen in our data that there is less willingness to engage in protective behaviors among more otherwise vulnerable groups. In fact, I think sometimes it's the more privileged people who are taking more risks because they can. It's part of the privilege.
Sure. So you don't think there's anything that could, in people's economic distress, that could lead them to undervalue their health? No,
we haven't seen that happening. We haven't seen that happening.
Fair enough. I mean,
it could. It's a good hypothesis, but it's not something that we've seen.
Do you think there's a level of sort of excuse in the public mindset for multinational companies? I mean, we've seen things like Amazon, for example, doubling their worth in this time during the pandemic, and yet still discontinuing policies like their hero policies for vulnerable workers. Do you think that the way that we sort of perceive different groups in society might inform this disparity in focus?
Sorry, can you repeat the question? I'm not sure I understood what you were asking.
Sure. So, for example, we've seen large tech companies double in their overall worth in this time, and yet when they have sort of essential policies in place for their frontline workers, they've sort of discontinued the policies like hero pay, for example.
Right.
And that seems to have gone largely excused in the public perception. I mean, do you think that this is related to how different groups see different actors in society in relation to the pandemic at all?
I think early on, everyone was trying to make statements about how upstanding they were, and we saw lots of that. And as times have shifted, people are taking less and less of that action, which is really unfortunate, obviously. I think also a lot of the rise in the stock prices of those big tech companies doesn't necessarily funnel through to them having more money that they can use to protect their workers. Now, obviously, all the sales that Amazon has had, all their revenue, they should have that plenty of money available. But I think that the demand for this just declines as we become numb to the situation. It's easier to see that when you go to the store and you see the people, but we don't see the people who work in the factories, or not the factories, the warehouses for Amazon. We don't see them.
Fair enough. I mean, what would you say have been the most effective strategies at raising public consciousness about the risks of the pandemic?
I think that the thing that has done the most to raise public consciousness about risk of the pandemic is sadly personal experience. It's not public strategies, it's personal experience. We've seen a lot of bad public strategies in terms of raising consciousness. A lot of leaders around the world who have not taken it seriously, both in my country, I think that in your country too. It's changed over time, but I think where we've seen the biggest changes with people is when they have personal experiences. And that really starts to shift their perceptions and their belief. Until it gets close to you, it doesn't feel real.
Sure. I mean, this is interesting because I mean, when we look at the sort of disparities in different countries as to how they have experienced greater impact of coronavirus in terms of loss of life, I mean, we see that in Vietnam, with a country of 100 million people, they've recorded around 35 deaths, whereas in France, with a population of around 70 million people, they've recorded around 55,000 deaths. I mean, what do you think explains these disparities? And how do you think it's undermined the public trust in institutions and their belief formation around the pandemic?
I think that one thing that helps to explain these disparities is that the more, when I talk to my colleagues who are from Asian countries versus Western countries, in Western countries we have much more of a perspective of our rights and we have much more of a perspective of our rights. And in Asian countries, they have much more of a perspective of their responsibilities. And things are centered much more around responsibilities. And while I think that, none of us would think of ourselves as not taking responsibility for our actions and not trying to be responsible citizens, it's very different when we also are thinking about our rights to move about freely, our rights to have a small business, our rights of all sorts of things. Whereas in other countries, they're able to really focus more on responsibilities, and that's a deep-seated cultural difference that really, I think, has helped some countries to be able to control the virus much better than others.
No, I mean, fair enough. I mean, do you think that
my hypothesis? It's not based on.
Sure. Of course. Well, we are here to hear what you think. So
yes.
I mean, do you think the political polarization in countries like the US has been a sort of main source of tension around COVID management? I mean, do you think people see it largely as a political issue rather than purely a public health one?
Oh, it is such a political issue here. It's really, really disconcerting. So it really, the way that people react is so politicized, and it really depends very much on where specifically you are. I did travel this year and spend some time in the South, in a place that was full of Trump flags, and where I live in California, everybody has a Biden sign on their front lawn, and they still have their Biden signs on their front lawn. And the general behavior was just so different. Mask wearing, behavior out on the streets, going to restaurants, just fundamentally different, even though the level of spread of the virus in the two communities was roughly the same at the two times. Just how people react is different. Even in California, in Los Angeles, where I live, which is relatively Democratic, and Orange County, which is just south of Los Angeles, which is more Republican, there are strong differences in terms of how people perceive the virus and appropriate response to the virus. And that's politics. If we had stood up and said that wearing a mask protects your freedom to move about freely, that would have been a completely different message. That's a very right-wing individual freedom message. Wear a mask to protect your freedom and protect everybody else's freedom. Instead, we say it and tell the story in a different way, and now it's become this political thing. We have states that won't pass mask laws. It's very political.
No, I'm very perceptive. I mean, one of the problems of all of the public policy around the coronavirus seems to have been the disparate effect on different stakeholders and interest groups in society, and the corresponding need for some value or normative judgment in policy formulation. Do you think that due to the sort of disparate impacts on different groups, that these policies are inevitably going to have somewhat of an equal effect on different interest groups, and that is going to exacerbate the tension and polarization, dissatisfaction around the coronavirus and the resulting perceptions that people have of it?
I think that this is a really difficult issue. We really struggle to understand perceptions of racial impacts and equity. I really thought we've been asking a question in surveys for the last 5 years about, do you think that African Americans and people, well, I asked one question, do you think African Americans have a harder time accessing healthcare? And we asked another question, do you think that low-income Americans have a harder time accessing healthcare than the other group? And I thought, with COVID-19 and with the murder of George Floyd and all of the protests that we saw in the United States around racial inequity, that the discussion of disparities and inequity would change, and that people would see that there was something different going on here, and that this was not something that we could just pretend like it didn't exist, that we could just go on and just treat it like, continue to see things the same. I thought people would change their minds. And we asked the exact same people the exact same question this year, and maybe like 5% of people changed their mind. So are we going to change people's views of equity? Are we going to be able to address these issues of inequity? I don't think we can address them in the ways that they really need to be addressed. I think we have to address them. Interestingly, what we have seen change in, we've seen change in one thing that I think could help to address inequity, but it doesn't in a way that's not about disparities. We've seen a growing percentage of people in the United States who support the statement that it is the obligation of the government to ensure access to healthcare for all, which is something that I've never seen before. There's been a big change there. So are we going to be able to go in and say, okay, we have to do something to help this group of people? No, I don't see that changing. Are we going to be able to say we need to do something that changes things for everybody? Maybe.
I mean, sure. I mean, in your own opinion, though, do you think that, I mean, one of the things we have seen in recent times is a lot of calls towards policies to help people in the face of growing automation and AI technology and whatnot. But now with the coronavirus, although we have seen, certain support for certain groups in society, there have been increased calls for policies like universal basic income. I mean, what do you think the realities of this could be in terms of the likelihood of it getting implemented? And do you think it would be worthwhile?
I mean, I think one of the reasons that works is because it's universal. It's not a targeted program. It's universal. Might not work, but why it's politically appealing is because it's universal. It's not helping a particular group. It's helping everyone. The chances of actually implementing universal basic income or some other thing like that, probably pretty small. It's pretty expensive. I'd be really interested to see it happen. Love to see what kind of, I mean, like I said, as a scientist, I'm always interested in these experiments, but to really do it at some large scale, I think would be extraordinarily expensive, and for it to have any real meaning, probably too expensive for anybody to implement, which particularly in a time with so much economic downturn.
But you don't think that the policies put in place in the United States, such as the one-time payment of $1,200 and the unemployment support increase, was sufficient, do you?
So we've been following people's financial well-being, and hang on a second, let me tell you the exact right number. And in any given month between May and September, 37% of people reported that they had, between 30 and 37% of people, 33% of people reported that they had financial difficulties. And if you take the intersection of that, so who had difficulty at any time, it was 45% of people. That little bit of money did not help enough. Still huge numbers of people who are having difficulties. And the way that they're addressing those difficulties is by, who has those difficulties is really targeted. It's really specific. It's mostly people who are not able to work from home, whether they're working or not. It's people who have jobs that are not protecting their ability, that aren't as flexible. So it's the poorest, but it's also in the middle income. It's people in the middle income who have jobs that they couldn't work from home. You can take the screen share away again.
What do you think are the greatest long-term and short-term impacts on people's finances from COVID?
In the short term, people they have moved past just accumulating debt. They are now turning towards other sources of income, or they just aren't able to pay their debts, or pay for things that they need. We're seeing increased food insecurity, particularly for children. One of the reasons that is happening is because in the United States, a lot of kids who are in financial need, they get food at school. If school is not happening in person, as it's not happening in person in most large cities, kids are not getting food at school. We're seeing people turning to borrowing from friends and family members, using payday loans, which have extraordinarily high interest rates. We see them selling their personal property. They're not borrowing from standard means anymore. They're moving on to these more costly things. And so in the short term, it's having a really dramatic effect. We saw that we have some data that's going to be coming out in next month, I think, that shows that almost half the people in our survey that we've been following say that they're going to be spending less on holiday presents because they just can't afford it this year. That's not because they aren't doing things. It's because they can't afford it. So I think in the short run, we've got serious problems. In the long run, I don't know. It's hard to know what kind of recovery there will be. I see two divergent paths and two different types of behavior that people will engage in. There are people who have missed all the things that they used to do, and they are going to go out, and they're going to go out twice as much as they used to as soon as they've had their vaccine and the world feels safe to them again. And there's another group of people that's going to continue to act in a reserved, scared way. And then there's another group of people that is still going to be reeling from the financial losses. And so I think the economic recovery will be slow. But I don't know. Hard to say. Really depends on how the vaccine rollout works, and how fast it happens for everyone.
Sure. I mean, absolutely. What steps do you think people could take, though, to mitigate the financial impacts of COVID and best account for their financial insecurity?
I mean, I think that there are there are groups of people who are not experiencing financial insecurity. And for those people who are not experiencing financial insecurity, they should do what they can, continue to support the economy, continue to get takeout food from restaurants, continue to pay their housekeeper, even if their housekeeper isn't coming to their house, things like that. Keep putting money into the economy. For people who are struggling, it's much harder. It's not like you can go out and just find a job, unless you want to work at Amazon. They are hiring, but the options are limited, and for those people, public policy is the solution. And I hope that we will see different public policy to support people going forward. I hope that our government will come to some resolution in the next week, to have some support now. But I can't say what will happen. If I had that crystal ball, that would be that'd be amazing. Yeah. Wouldn't we all like the crystal ball?
Yes, indeed. I mean, with regards to lockdowns, though, a lot of people have argued that a certain public health hazard has been putting people at greater risk of economic hardship, mental health problems, even suicide and domestic abuse regarding lockdowns. I mean, how do we judiciously balance the risks posed by COVID and the need to halt its spread with the damages of a situation where we don't have 2 weeks of quarantine, but many months of economic closure and social restrictions?
It's hard. I mean, your lockdowns have been much more severe than our lockdowns. Our lockdowns have been not like yours. While people aren't seeing as much of their friends, we're allowed to go out. We're allowed to go for walks. We're allowed to get in our car and drive wherever we want. Our limitations on our freedom have been much less significant than they have in the UK. And I think because of that, the effects on mental health have been much less significant. I think that it's a balancing act, and it's one that each person at some level needs to think about for themselves, in the context of whatever legal ramifications they're facing. Obviously, I'm not suggesting that you break the law, but not at all suggesting that. But there needs to be some flexibility for people to be able to, have some mental health. The mental health impacts are certain, and the COVID impacts on any individual are probabilistic. And so we have to balance that.
I mean, with regards to rule breaking, you mentioned earlier that it seemed to be people in higher income brackets or social positions that were, skirting the rules, so to speak. I mean, why do you think that is? Why do you think they have a different perception to people in other areas?
Two things. I mean, here, one reason is because the risk is lower for them. I mean, we'll use Donald Trump as an example. He can break the rules. He can get COVID. He can go to Walter Reed and get the absolute best possible available medical care. And the same is true for rich people, really, really rich people. I mean, they're going to get the best possible medical care no matter what. And so that makes it less risky for them. But I think also the risk feels farther. One is true measure of what the risk is. And the other is the perception of the risk. The risk feels farther away. I know that in Los Angeles, the number of people being diagnosed with COVID every single day is, right now, yesterday was over 8,000 people in Los Angeles were diagnosed with COVID. I've heard that in Santa Monica, which is where our RAND office is, 2% of people probably have COVID. I don't know anybody who has it. So it doesn't feel like it's here. I mean, I know it's here, but it's not here. And I think that that's true for a lot of people. You know it's there, but it's not in your little bubble. And I don't mean that in the sense that you can form a pod or a bubble with some other family. I mean, it's not in your little circle. And so it doesn't feel like the risk is as great. But in other communities, it's there, and you know someone who has it, and you know someone else whose brother had it, and it's really it's hard to pretend it doesn't exist.
Yeah, no, I mean, I think that's certainly fair. I mean, but do you think that the idea of people feeling like they aren't represented by their institutions and whatnot, that that's just been sort of brushed aside in the face of actually seeing the raw examples of people literally just dying in their local communities? Do you think that's do you think that's had an impact of renewing a sense of public faith in certain socioeconomic circles?
I don't think there's been any renewal in the United States of public faith in trust in government and institutions is definitely declining, and it's very low. We'll see how that changes.
Yeah, I mean, on the subject of change, though, I mean, mentioned before the idea of people not wearing a mask or whatever, the politicians not wearing a mask. Donald Trump, refused to wear a mask for a lot of the time in his presidency. Do you think that the approach of the United States to this and the public perception of the coronavirus might change with the incoming administration?
I think that the answer to that is going to depend on how the media continues or doesn't continue to cover the views of people like Donald Trump. If his views are still out there being espoused in the media all the time, if his voice is still there are people who will continue to listen to him. I heard this morning on the radio that 75% of Republicans think that there was something unfair about the most recent election. Democrats, none of them think that, or some number that is so close to none of them that I feel comfortable saying none of them. And it's all about the information that people hear, and a lack of shared information. The civic infrastructure in our society, and this is something else that I've been working on, and our trust in government and media and the way that we think about institutions and information is very fragmented. I used to teach an economics course when I was teaching that course to undergrads, I would talk about the great thing about the internet is that everyone can find the thing in the space that they want to be in. If you are someone who collects, 1920s collector's item baseball cards or toys or whatever, you can find your community. And that's the great thing. But we can also all find a community where we end up hearing only the news from one perspective and completely ignore whatever news is coming from the other perspective. And that has definitely hurt the information spread about COVID-19. That's definitely been bad for this.
Yes, of course.
There's one thing, right? Like, this is an infectious disease. This infectious disease kills people. You can protect yourself and others by maintaining social distance, and by that I mean really not interacting with people, by wearing a mask, by washing your hands, by staying away from people who are likely to have the disease, by staying away from people who if they got it would be at greater risk of death, or who might spread the disease more. These are facts that other people do not hear because they live in a different world with different information. And that has dramatically impacted the way that the virus has spread in the United States.
Yeah, no, I'm sure I've seen a lot of that on our news myself. But I mean, it's interesting you talk about information. I mean, I'm wondering if you've had a chance to look at the types of groups that would, for example, be more likely to believe conspiracy theories around the spread of information around the virus.
Actually, I did. We did look at that a little bit, asking some questions about conspiracy theories in the virus, and it's definitely out there. It's not when we did it, not as extreme as I expected to see, but I might have asked about the wrong conspiracy theories, or at the wrong moment. I'm not sure. So I think that it's definitely there. It definitely matters. I think the biggest thing that I still hear is, oh, this is not a big deal. And it's just something that people have like talked up, but I don't think that that's the case. My next door neighbor's father died. I'm pretty sure he died of COVID. Like, I mean, that's what they told her. And I believe it. I don't think it's fake news.
Sure. Oh, no. Of course.
No. I'm not arguing to you. I'm just saying, like, this is not fake news.
No. Yes. Do you think there's a certain commonality in the people that you did ask of being of certain social categories in society that tended to ascribe to these views of not thinking it was such a big deal?
It tends to be, I mean, it's basically everything falls on party lines in the United States now. It's Democrats versus Republicans. It's not all Republicans. It tends to be less educated Republicans, but even that's not always necessarily true.
Sure. I think we're going to move across to some questions from the audience.
Oh, great.
So if we could bring the first one up now. We've got one from Rachel A. Which communication tools are the most effective at raising/changing public opinion, and which countries demonstrated this with the coronavirus crisis, and how?
Changing public opinion is extraordinarily difficult. Changing views is really, really hard. I think the country that I have seen that has done the best at communicating about this is Germany. I think Angela Merkel has done a great job talking about COVID and talking about how the response and how individuals should respond. I think that's the one that I've seen that I think I'm the most impressed by. But that could just be because I have too many friends who are German.
Thank you very much. Next. Is there a risk of the vaccine announcements decreasing public perception of risk?
Yes, I think that this is definitely something that I have worried about in the past. I have some old research that I did back in like 2008, where we asked people about the risk of influenza and looked at how that affected their likelihood of getting an influenza vaccination. And what we found was that people really did not understand the risk of dying of it from influenza at all. And they had really overblown ideas of how much the chance was that they would die from influenza. The actual risk for someone under 40 is like 1 in 400,000, and people thought it was something like 1 in 5. If we were to correct that and let them know what it was for real, would anybody get a vaccine for influenza? Probably not. Like, why bother? Like, you're just going to get sick for a little while and then you'll feel better, but it's still worth it. And I wouldn't correct that. I wouldn't go out and try to correct that misperception. And I think the same thing could happen here, that the vaccines could change people's perceptions of the risk. And one thing that I just read that I think is particularly worrisome is what we know about the COVID vaccines right now is that they reduce the risk of extreme illness and death. What we don't know is whether or not they reduce the risk of asymptomatic infection. And if that's the case, people could get their vaccine and potentially still pass on the disease to someone else. And so I think we have to be very careful about how the vaccine is communicated, and very careful about how that affects people's perceptions of risk and their perceptions of the behaviors they should engage in and continue to engage in.
Thank you. Next. How could the politicization of this pandemic have been avoided?
Oh man, I don't know. Different leadership, belief in science. Oh God, if I could go back and change time, I would. I don't know. I wish that there was a good answer to that. I think that yeah, different leadership. I don't think there's anything we could have done to change how people like Donald Trump and Bolsonaro responded to COVID.
Once people actually do have different perceptions, how do we handle them? How do we balance individual rights with the collective responsibility in a disaster situation?
So this is something that we have been thinking about in some work that we have ongoing right now about perceptions of vaccines sort of more broadly, and how we use that information to target information. So some people always get vaccinated. Some people, they do it and there's nothing you have to worry about. They're gonna get vaccinated. Some people are sort of like, yeah, sometimes I'll get my flu shot, sometimes I won't. And some people are, well, I never do this. So what do we do with this information? We actually can figure out who those people are. We can figure out who the never, sometimes always people are. And I think that once we know who those different perceptions are, we need to think about how we target information differently to different people to help them, give them the information that is meaningful to them. For me, someone who's, gotten their flu shot every year for the last 5 years, probably all you need to do is tell me, show up at this date and this time and get your COVID vaccine, and I'll show me that that it's been approved appropriately, and I'll show up and do it. For someone else, who's kind of on the fence, you might need to provide them with different information. And so understanding where people's differences in perceptions are, and helping to give them the information that will be convincing and meaningful to them, I think is important. So I think that one great thing about technology and different sources of information and different ways to target information is that we can do that. We can target information. How do we balance individual rights and collective responsibility in a disaster situation? I think that that's really very difficult, and that part of that is about talking about collective responsibility as a way to protect your individual rights. This isn't something I hear people doing very often, but that's what I would like to see more of. Your collective responsibility to our society is to help keep things working. And by doing that, you protect our individual rights. You protect our individual rights to thrive. You protect our individual rights to be safe. It's not just the right to move about safely. The right to be safe is just, I'm sorry, it's not just the right to move about freely. It's also the right to be safe. And if we were to say that you have a responsibility to help make sure that people have the right to be safe, that would be a very different message, and one that would balance individual rights with collective responsibility in a different way.
Sorry, if I could just pick on a strand there. I mean, it seems like you're saying that information is the central key, but is also enough. I mean, do you think that just talking or framing a message in a particular way is enough to tackle something like this in a country as polarized as the United States, for example? Do you think we actually need legislative policies on that implement or include those messages?
I think that the messaging really matters, and that you could pass legislative policy, but if you don't message it in a way that is accepted by different people, it doesn't matter what rules you pass. You don't change people's thoughts and behaviors. But if you can talk to people in a way that is different, then you might be able to change the narrative.
So you think that if we get the right message and frame it in the right way and target it in the right way, then that'll be enough, and we don't need additional policies on top of that?
No, I'm saying that you need a combination of the two.
Right, fair enough.
Okay, and if you only have the policy and you don't have the right message, then it doesn't matter what the policy is. Sure.
Can we have another question, please? Especially in liberal democracies, the state doesn't monopolize the public conversation. Films, media, NGOs all have audiences. How does this affect perception of COVID, especially with dissonant info?
I think this is one of the big problems that we have. The state, I mean, it's true, the state doesn't monopolize the media. Even if the state does monopolize the media, you could have vastly incorrect information coming from the state, or truthful information coming from the state. But differing sources of information definitely is something that concerns me, and something that we're really thinking about a lot at RAND. Different perceptions of truth, and how our shared perception of fact has started to shift and change over time. And that's never good, but that's particularly bad when you're facing a global threat like COVID. It's definitely really had a terrible impact on the spread of COVID in our country. It's devastating, and it's something that has me very concerned. We are doing some work now to think about how people perceive information and what kinds of information they like to receive, how they perceive the news and different sources of news, and how and by different sources of news, I don't mean do they listen to Fox News or MSNBC or something even farther left or farther right. I don't know if I put my hands in the right direction, but more polarized than that. But the way that stories get told and the way that information gets shared, to see if there are ways that information gets manipulated to try to change people's views or shift people's views even more. And I think that that's one of the pressing problems facing our our society, and also not just in the United States, but also in Europe. We do have actually an office in Cambridge, and they did some work last year. I don't know, in the before times, about what Rand is calling truth decay, which is the perception of information and the role of information in our society, not only in the United States, but our office in Cambridge was doing that about the role of information in Europe. And I think it's something that we need to think about, and it's the big issue. It's one of the big issues of our time. After we figure out how to survive COVID, we need to figure out how to survive misinformation.
Sure. I mean, just with regards to the certain narratives of information that I feel that this particular question could potentially lead to a conversation on. I mean, it seems that in Western societies, especially in the United States, there are sort of conflicting narratives of, of conflicting motivations behind certain narratives. So in government, they have a task of trying to keep people safe and provide the best source of life, but certain news corporations, such as CNN, Fox News, have a sort of motivation in their narratives of keeping people watching. I mean, I believe the style of message selling in CNN is, that of characterizing in a sort of sports channel type of way, hyping up the information as much as possible. And then with Fox News, I mean, they've even said themselves that they're actually an entertainment network, not a news network before. I mean, with these sorts of messages, do you think that there is a potential for great conflict regarding the idea that you could have a very powerful federal central source propagating a certain message, and then a conflicting narrative that's also essential to Western countries of a news corporation just trying to hype up and make things seem a lot more dangerous and spreading certain, not necessarily saying they are, but certain forms of misinformation to keep people watching?
The profit motivation of for news organizations is definitely part of the problem that we've identified in our work in this area, and I think it definitely makes things more difficult. It's not necessarily even the case that a nonprofit would be better, because a nonprofit still has to find some way to stay afloat. But yes, this is part of the problem. I 100% agree.
Do you see any resolution going forward, or do you think it's just going to get worse? I mean, you're talking about the sort of decay of truth. I mean,
yeah, we've been talking about helping people learn to understand information and learn to understand when information is factual and when it is opinion. This is one of the problems that we've seen, is that people's ability to distinguish between fact and opinion is not as strong as it should be. People's ability to distinguish between narrative that is anecdotal versus facts which are universal narrative which is anecdotal and information which is more based on statistics and large numbers and more universal is limited. And I think that we need to think more about that. I will say one ray of hope is that young people are actually a little bit better at identifying this information. But it's something that we need to work on. And, fact checking, I think, by organizations like by companies like Facebook and Twitter, I think that's part of it. We have to have trust that they're fact checking appropriately, and I don't know that people have that trust right now. But more important than that is to help people, individuals, understand what is the news that they're consuming, and know when they're looking at something that is based in fact and reason and when they're looking at something that is based in hyperbole and opinion and anecdote.
Of course. No, sure. I mean, thank you ever so much for your talk. I'd just like to pass over to you for any concluding remarks that you may have.
Oh my gosh, this was so much fun. We've covered, I have a list of projects on my wall over there, and we have covered almost all of them today in one way or another. I think that the pandemic and the problems that our societies are facing, whether it is the life and death situation of COVID-19, the financial and economic difficulties that people are facing, and the role of information, really are all things that are of great importance to all of us. And I'm really excited that you are all interested in hearing about my work today. Thank you so much.
No, thank you ever so much for being with us. It's been a pleasure.
My pleasure.
Well, I mean, that's just about all we have time for today to our viewers. Thank you all for joining us, and be sure to tune in next time for another episode of Political Futures.